panel that we have really shines light not just on individuals, but what our partners have been doing, not for one particular organization, but for many. So our partners, they work to provide mental health accessibility to many people. So it's one to many people. You will get a bit more when you know who I'm going to invite up on stage. We have first Choon, CEO of Health Promotion Board. Let's give him a round of applause. So Choon is CEO of Health Promotion Board. Previously, he served in many other acronyms. I'm going to start MCCY, PSD, MHA, basically a veteran in the public service sector. So welcome, Choon. And then we have Grace Fong, Regional COO of Lockton. Let's give her a round of applause. And with her, she has more than 13 years of employee benefits experience, so gonna learn a lot more from her. And of course, last but not the least, Dr. Peter Chow, CEO, IHH Healthcare Singapore. Thank you for joining me, panelists. You've got your mics. Okay, so I told them that we're at the last session before lunch, and they said, no pressure, it's just gonna be a casual chat. So please bring your smiles on. Today, what we want to do is to dive deeper into this national mental health strategy that everybody seems to be talking about. So shifting gears a little bit from just organization, we are going to look at basically population groups and what does this national mental health strategy actually mean for whatever organization you represent. But before that, since we're going to keep it casual, we're going to start with a more icebreaker question, which is, what is your own guilty pleasure? Why guilty? What is, maybe not guilty, just what do you do to manage your own well-being? We'll start with maybe Dr. Peter. Doesn't have to be guilty, but can be.
Okay, I'll be very honest. Sometimes when you need that time out, I'll hide myself away. And you know, sometimes you can be at home, post-work, away from even the family. You need time and space for yourself. Sometimes, I'm sure some of the introverts in the audience, you know, right? Even hiding in the toilet cubicle can be a bit of a relief in a big event like that. Yeah, so sometimes you need to create that time and space for yourself.
Why did I start this? But actually, I do hide in my car a lot also. So now everybody knows. Okay, thank you. How about you, Grace?
I was just sharing this with one of your delegates and attendees because of the previous question that came up, where they asked what was the last thing you do, what first thing? So this is quite recent. I'm actually quite embarrassed to say this. I'm trying to learn a Thai pop song. And because of that, and Spotify, the good friend of all music, learns about your listening styles. And they keep popping things to your playlist. So and it's an indulgence over the last 2 months that I have been listening to Thai pop songs. And because I commute to work, very easy, ESG, don't drive, commute to work on the train, early in the morning, I'll be listening to the music, and subconsciously, I'll be moving. And on the train, this is very embarrassing. If you ever bump into me on the train, don't do this. But subconsciously, I'll be doing like this.
So,
to me, that commute is a way to wind down or get ready for the day or get ready to bed.
so Grace is a good friend, so I'm going to ask, should I put you in a spot to make you sing your Thai song? Choon says, yes.
I did say to somebody that
Give me the eye signal. Is this time?
I'm still not complete.
Okay, gotcha.
No.
Next year.
And I don't even know what it means.
Next year this time, Grace, you'll have the center stage yourself.
I'm just open a gig. Oh.
Okay, Choon, what about you?
Okay. Hi everyone, glad to be here. For me, the thing that I usually do is physical exercise, which is not just the physical part, but is just taking myself out into a different mind space. And for like an hour, it's just not thinking about work, just following through with the exercise routine, which helps a lot.
So do you enjoy exercising?
Yeah.
Oh.
Yeah, one little known, maybe not so little known, some of you know this. Until late last year, I was teaching indoor spinning. Yeah,
you teach indoor spinning? Where is my
teach.
partner, Alisa?
But I stopped since December last year.
Okay,
yeah.
wow.
It's essentially just bringing myself into a different space.
Right. Okay, thank you for sharing. Thank you for sharing. I've learned something new. I've known some of you for a while. I didn't know all of that. Now, diving straight into the topic now, National Mental Health Strategy. Now, why we have three of you here together on the panel, just for everybody to know also, HPB represents the forefront of bringing awareness, a lot of the awareness to Singaporeans when it comes to mental health. So we'll find out a bit more about what HPB does. Lockton is at the forefront of receiving all these employee trends because you will hear from a lot of HRs, people like yourselves, about what you need for your employees right now. And then of course, Peter wears two hats. One, he is of course looking after the hospitals that you might be familiar with. So whether it's Mount Elizabeth Hospital, Gleneagles, the clinics that you see. So it's healthcare, so looking after the patient's mental well-being. But also he steers the ship for a very large organization. So he's CEO, looking after a very diverse workforce, people who are in the front line, the people who are there to fight whenever there is COVID or whatever new disease that comes up. It is very stressful, but also diverse because there are also people not at the front lines, but also supporting the work. So Peter then wears on two hats, okay? So we'll start with HPB first. So after this National Mental Health Strategy, how did that frame what HPB is doing right now? What are some of the strategies HPB is taking to bring awareness?
Okay, so for HPB, we're in the preventive health space. So naturally, we look at the spectrum of people who are well and maybe just early at risk, right? And what do I mean by that? Is people who, like most of us here, who in the clinical term, right, don't necessarily have the lived experience, but may feel stresses from time to time, and then what do we do about it? So three main areas. The first is about normalizing mental health and well-being. Right, we keep saying normalizing, and I think we need a sharper definition. It's essentially building mental health literacy. Right, when we talk about mental health and well-being, is it just absence of illness? Or is it more the presence of things like resilience, coping skills, emotional self-regulation, and so on? Right, so I think that's very important to give us the language so that when we want to talk about mental health and well-being, it's richer, right? That we can bring in our individual state, right, into the conversation. Second area is then what do we do after with the knowledge, some level of skills equipping. Right, so on the MindSG website, you can see a lot of resources that we have curated. In the past, different agencies put out different content. What we have done is to pull it together into one stop. It's all evidence-based, curated by professionals, right? So if you just go there, the evidence is pretty strong in terms of what we put out. There's also fun videos that you can watch. Recently, we launched the latest iteration of the mental health series of videos talking about empathy, right? Which just launched last month. And then in terms of the self-efficacy aspect, next month, so I'm selling a lot of Goyo, Healthy 365 will have a new sleep challenge. So please download the app, get a tracker. You can bring your own tracker as well. Sleep tracking is shown to be quite effective in helping people realize how much more sleep they need, and then to nudge you into sleeping more. And you get health points, which you can convert to vouchers. And the last area is on training peer supporters. So all of us, when we need help, the typical response is, who would you go, right? 8 in 10 of us will want to reach out to informal networks, so family, friends, and so on. But we need people who know how to give you the right advice, right? So that's why peer supporter training is important. Otherwise, most of us do not know what to do, right? If somebody goes to you and say, I've been feeling depressed, and they're like, take it easy. I think those things don't work. We actually need people to be trained to have a much more supportive role and more effective in playing that role as well.
Thank you. And now that the National Mental Health Strategy is really in the spotlight, have you seen like a shift in terms of receptiveness to whatever HPB is doing?
Our sense is that there's been a lot more chatter, a lot more recognition of the importance of being able to talk about mental health, which I think that's a very good stance. We looked at various facets, like are people more willing to approach mental health professionals? The indicator has gone up slightly, still about 6 in 10, perhaps more. But willingness to reach out for help has definitely gone up.
Okay, thank you. And I guess this is a good segue to Grace. Do you see that shift in like receptiveness when it comes to the employee space or the employer HR space?
Definitely. I think just to share a personal encounter, just 3 months ago, I was catching up with quite a few sort of contacts in the field, and I've come up to hearing real stories about people suffering from burnout. And these are people who are, some of them in their 20s. 20s is a bit scary, right? To think about them feeling the burnout after 6 to 7 years of working. Some are in their 30s. I'm not going to say my age, but some are in their 40s. And they've actually told me that they have gone out to seek help. Whereas I think 10, 15 years ago when they first started the workforce, they just got on with it. So I think kudos to National Board and kudos to, I think, the government in Singapore really driving the message out, at least as population awareness, public awareness. And that helps because it actually helps HR's job a little bit easier, but it's also a flip side of the coin that HR now then has to sit up and say, what do I do about this? How do I support my business in making sure that these initiatives, these messages, what can I do to support my employee population, and it can be vast as well, to really help them overcome this. So first and foremost, kudos to HRs who are here. The fact that you are here tells me that it is a very important agenda in your business plans. That's number one. Number two, I think the challenge is also sometimes there's so much information. I think I shared a little bit with you about that during our briefing. So much information. How do I distill it? I mean, I'm not a doctor in psychology, right? And some of you are, and some of you have even gone a step further to equip yourself with knowledge. For example, your first aiders training. I mean, those things really just equip you as an HR to help digest the information and therefore think about how do you then think of the appropriate solutions out there. So we get engaged a lot, not because we have the solution for you, but because it is brainstorming. One thing about getting it right from the start is also trying to build your confidence in making sure that you check in with your colleagues, you check in with leadership, you check in with employees to get feedback at every kind of initiative that you're doing. And I think being very intentional about what you're trying to achieve, I think from a business perspective, that is highly valued. I think there's later on some topics about I think we covered quite a bit on earlier topics about leadership. I think that plays a humongous role in driving effectiveness as well.
Yeah, for sure, agree. And for Peter, then now shifting gears, you have under IHH's belt private hospitals, clinics. How does that, I mean, those are typically physical health generally. How does that fit into the national mental health strategy, or how do you see IHH's involvement in the national mental health strategy?
Okay, so you're right. I think IHH, because of the diversity of our business, we are actually a very, very integrated health provider, and I wouldn't say healthcare provider. So on one end, you see on the one spectrum, we run some of the private acute hospitals like the Mount Elizabeth, the Gleneagles Hospital, and so on and so forth. And when people come to us, and we actually have a system and a network in place to be able to provide psychiatric support for people who, for example, at the first, your cancer diagnosis, or people who are terminally ill. And recently, we have actually started working with Intellect to also extend the FOC to the mothers who are coming into a hospital to deliver, because we know postpartum depression is a very, very common issue, right? So this is what we do at that end. We also, like what Cassandra mentioned, we run primary healthcare as well. So as part of the entire Healthier SG that the government is pushing out, we have actually been training our primary care doctors as part of the primary care network to be able to identify mental health issues in patients. So that's also healthcare. But I think something that most people are not quite aware that we do is we also run a company called iExchange. iExchange actually is a third-party health benefit administrator. We actually administer to about 600,000 employees, and actually that's quite substantial. You think about it, it's about a quarter of Singapore's workforce. So I'm sure amongst the HR practitioners here, some of you may be familiar with iExchange. Now, the concept of us going out to work with HR practitioners and companies on the concept of not just sickness, but on preventive health and wellness has actually been in place throughout these few years. So take, for example, we extend health screening packages to companies, right? And we encourage companies, and part of the benefits that you give to your staff are health screening entitlements. Now, we are also thinking about how we can extend this whole idea about mental wellness prevention as part of the entire health being and wellness being package to companies as well. And I think what was shared earlier in this forum, the whole idea that companies, corporate should start looking at health as and wellness as a resource, mental wellness as a resource particularly, is something that we are trying to promote as well. So I think that one, admittedly, we are really at the start of that curve, right? But I hope that gives you an illustration of how we see ourselves from all the way from people who are critically ill, terminally ill, needing quaternary care or tertiary care, all the way down to the people who are well, like all of us, and how we extend and build up their mental resilience and their health. So this is really, in a nutshell, that whole scope and strategy of IHH Singapore.
Okay, thanks, Peter. And actually, that's a good segue to my next point, which is more focused on individuals right now. So since you've talked about that, let's start with you, right? So for patients, you mentioned a few just now, say cancer diagnosis or mothers. Can you share a bit more? How do you envision mental and physical health to be, how does it package together to support an individual, mental versus physical?
It is very integrated. I think healthcare professionals will tell you that it's very hard, for example, people who are coping with illness, physical illness, if they are not mentally resilient, it's very difficult to manage them. So I think even within healthcare sector itself, we already have the understanding for a long time that there has to be an integration between mental wellness management and physical wellness management as well, right? And I think, for too long, we have actually been trying to compartmentalize health into diabetes, whether you have an orthopedic problem, and then we see mental health as if it's something that is totally alienated from mainstream healthcare itself. I think we should stop actually looking at that and understand that it's integrated. So, for example, Choon teaches spin training, right? And if you don't have some level of mental resilience and motivation, why would you be going for spin training? Just because you want to bring down your blood sugar level? Nobody does that, right? So you think about the whole construct of human and how we think, then you will understand how integral mental health is in the entire landscape of health and wellness.
And so IHH's plan is to really build that holistic mental, physical integration into different conditions. That's really remarkable. And then I guess shifting gears a bit to individuals again, but now employees. So maybe Grace, do you see specific employee groups that actually need more support or a more specialized support? You mentioned burnout earlier. Are there special groups or groups that need more specialized care, you think?
One that is pretty synonymous in terms of the feedback I've gathered from HR is that middle management group, the sandwich group, in both from a professional working perspective as well as from an age group perspective or life stage perspective, where from their personal life they're dealing with seniors, elderly. They are the caregiver for both the seniors as well as the young. So sandwich is 24 hours, right? You are middle management. At work, you're trying to manage or lead or guide or mentor the younger employees and working with stakeholders to manage numbers. Flip, you go home, you're doing the same. So this piece it's quite an area that quite a heavy focus on a lot of employers to equip employees with skill sets of how to manage that. I think something that we don't talk about often is people who are experiencing some sort of domestic violence, not highly talked about. And domestic violence doesn't have to be physical. It can also be emotional and mental, right? To Peter's point, it's quite aligned. So that's something that we're hearing a little bit, and in some other Southeast Asian markets, we're hearing a lot more. So domestic violence is another one that we are very sensitive about, but also an area that's a little bit tricky to deal with because people may not be willing to open up.
And based on your experience in, say, the regional markets, are employers actually taking steps to say, we want to support our employees through all these? What can we do?
Definitely a big emphasis has been on communication. A lot of employers are now saying we've got to lift literacy up, we've got to educate. We are, to some extent, over-communicating because we want to make sure that their workforce, and can be quite diverse, particularly in Singapore, where we're dealing with 4 or 5 different generations, to message communication that's tailored and personalized to the audience. So there's a lot of emphasis around messaging and communication. In the other regions, because they're a lot more spread out, so the outreach takes a bit more time. Yeah.
For sure. And I guess when it comes to communication, then this gentleman on my left takes the center stage. We've heard a lot today, and one stat that keeps coming up is the 1 in 3 youths, right, reporting very poor mental health, age 15 to 35. And of course, we also looked at older adults, 60 to 74, they are less willing to seek help. So do you see the same trends, and are you observing these trends and putting more emphasis on these 2 groups?
I think for each of these groups, we have to understand what is their social context around them. It's not just something biologically that happened and they have mental health issues. So for elderly, for example, one big part is social isolation, and the other part is preferiority, right? And especially if they start to lose their mobility, their ability to function within the community to preserve their social networks starts to go down as well. So we see that as one of the key driving factors around what's driving for elderly. And then for youth, on the different end of the spectrum, it's more of societal expectations, parental expectations, keeping up with the peers, social media 24/7, text endlessly. It all contributes to a sense of it's never ending. You can't really unplug, right? So I think if we really want to look at each of these groups, we have to understand the social context, and then importantly, figure out messaging, communication, whether there's a certain intersectional element that you need to address as well. So no point telling someone to pick up more skills, do more mental well-being, because I'm really so busy, right? And I'm still supposed to do more and be even better. I'm really feeling like I'm not good enough. So things like, messages like this may not go down so well, right? Because it feels like it's not empathetic, it's not relevant, right? So I think as organizations, businesses, and the government, we need to understand what is happening, and then to figure out how to better cater the message, including at workplaces potentially is, what do you need to start letting go of, right, in order to fit in some of these mental health initiatives, you know. Yeah, otherwise there's no space.
Yeah, so a common thing that partners tell me all the time is that mental health is really very nuanced. Whether it's nuanced based on the population, the country that they are in, there's so much nuance that we need to understand before we can tailor something for them, rather than to have like a one sweep, and you know that typically doesn't work. Okay, now the last part that we want to do is look forward, right? So we've looked a lot about reflecting, a lot of these reports and all that. Now looking forward, maybe Choon Hong, from your perspective, what is success for HPB? To you.
Okay, I have a short answer and a slightly longer one, right? If you don't remember anything walking away from this, the only thing that you need to do is to make sure you get enough sleep. Okay.
Everybody is talking about sleep today. Interesting.
We seem to have forgotten the importance of sleep. The human physiology has not evolved to be working so long hours. So sleep at least 7 hours a day. If you can get there, a lot of your issues will go away. So that's the short answer. Very impactful though, highly evidence-based. But the longer thing is actually about picture of success, the kind of skills that we need as individuals and as society, right? Emotional regulation, self-efficacy, mindfulness, resilience, social networks, and so on. I think those are the dimensions that are super important for mental health and well-being, but we typically think of mental health as just mental well-doing, right? Do more self-care, and all those bumper sticker kind of things. They don't go very far, right? So if we are able to build skills in those areas that I mentioned within the larger community and workplaces among the youth, I think we will be more successful, because it is about equipping individuals to be able to exercise that autonomy.
Thank you. And shifting gears a bit to IHH Healthcare right now. So you have a commitment, building a better world. What is success to IHH Healthcare in integrating physical and mental wellness?
So what we hope to see, and what we have already started practicing within ourselves, is we want to see mental health as an asset rather than just a pathology. Okay. So we internally have started Great at Work for IHH Singapore, where we make sure that it's great for staff to be at work and for them to be great at work as well. So I give you an analogy, right? Moving away from mental health, just looking at it as a pathology, a sickness, and a problem that we need to solve. I think as corporates and organizations, because I'm also wearing a hat of an employer who hires about close to 6,000 staff, we need to start to see this as an asset that we want to build within our organizations. So for example, a chief of army, right? He will be very pleased if his whole army can run 2.4 kilometers at a certain time and all are NAFA or IPP gold medalists, right? Because he knows that when there is a war, he can fight the battle better. And so similarly, whether it's ourselves or your organizations, I think we need to be convinced that when we are able to build up that mental wellness and the resilience of our staff, it becomes currency for you in your business. That's what we hope to see.
And I think really kudos to IHH Healthcare. We have seen them really take actual steps forward from, many. I think you have a huge population who are MHFA trained in terms of employee base, to actually providing Intellect as an end-to-end platform for all your staff, not just in Singapore, right, but in all the other markets as well. So that's really a big step forward. And Grace, what about you? What do you think is success in the employee benefit space when it comes to mental health?
I don't think I want to speak for 2,000 employers in Singapore, but I can say something hand to heart, at least from my organization. It's an ethos and belief for 65 years within the organization that happy employees will bring you good business. And whilst we say we put clients in front and center of everything we do, we actually do take a step back and say we put our associates in the center of what we do. So I think that's a very simple philosophy which resonates at least with me, and I do think it also resonates with some of the employers, because people are their assets, right? So I think with that, it then brings about how do we bring the best out of your people, and what does it mean to support them at leadership level, giving them the tools to understand, to recognize that there is a problem and not be shy to deal with it. I think that will then propel to a lot more of other initiatives.
Exactly. Thank you. Now we have no more time, but I thought it's interesting because I have C-suite here, even though it's not a C-suite panel. So this is off tangent, and I know I don't have enough time, but I always do this. I just wanted to ask, can you leave one advice for your employees? What would you say to your employees, 6,000 or how many? What is one advice you would give to your employees about looking after their mental health?
It is about empowerment, right? And empowerment in the mental health space is essentially talk to your supervisor about your mental health needs. And it's not so much whether you are having a psychotic breakdown or whatever, but it's just, actually, what is the work arrangement that suits me as in the context of an effective and happy team, right? We carry a lot of assumptions around expectations of work behavior, right? So if the boss, so I've been told this, right? If my Skype red dot is on, it means I'm online. And somehow people will stay awake in case I need something. I'm like, no, if there's something that's really urgent, I'll let you know. right? But there is somehow we have this very hierarchical and very assumptions type of way of working. Dispel all of this, and the only way to do that is to have that conversation, right? Work out what is the arrangement such that you will have a better work-life balance.
Thank you. And Grace, what will you tell your team?
Self-care. And I say it with a hand to heart to say that you do need to take care of yourself at all levels, whether you're an individual contributor or you're a manager or C-suite leader. Because if you don't take care of yourself, it permeates through and it shows when you're at work. And that then becomes a very may create an uncomfortable situation. And I love talking about psychological safety, and you are on that panel as well. It is extremely important to create that environment within your organization, within your team, to allow employees to be open and communicative.
Thank you. Peter, no pressure, but I realize many of your IHH team is sitting in the audience. So what would you like to tell your team?
So I think some of them can vouch for me. When I was a hospital CEO, I used to conduct orientation talk for new joinees, and I tell every one of them this. I said, you need to have the accountability to take care of yourself physically and mentally so you get better and better so that you can enjoy the fruits of your labor at the end of the day. No point working very hard. I think a lot of times Singaporeans, we tend to hold ourselves to very, very high standards. We work very hard, but we forget that our physical health, mental health break down. At the end of the day, at the end of your work career and your life, what do you look forward to? You must be able to enjoy the fruits of your labor for working so hard. That's why physical and mental health is so important.
Wow, and with that, please join me in thanking our panelists. Thank you very much.